been riding around the state of Maryland, meeting with hospital leaders, and it's been astounding to me how frequently the subject of workplace violence comes up. Probably at least half the hospital leaders I've met with have brought up this issue as a concern for their workers, for patients who are indirectly affected by it, and for ultimately the quality of the work environment and the care environment that they operate.
It's interesting, you know, the statistics indicate that of all of the assaults that are reported to the Department of Labor, 75% of them occur in healthcare. And so that's a huge number as it compares to every other organization or industry.
That's what, I mean, certainly workers in high-risk settings that I have the opportunity and really the privilege to learn from, talk a lot about their concerns of just, increasing violence because they have more acutely ill patients who are, perhaps more cognitively impaired or more of a danger to themselves than others. So I think it's, the top issue in a lot of settings like the emergency room, behavioral health, geriatrics.
Workplace violence has increased over the years. It's very real, it's on the rise. And so it is something, sadly, that we are experiencing as healthcare providers.
I do think in the past, and I go back maybe 40 years in our profession of nursing, we didn't feel unsafe in our areas. Even in home care, people felt like nurses were protected because of the work we do. That culture has changed, and the idea of incivility in the workplace is just rampant right now.
Well, I mean, I've seen patients, pound their fists or pound the wall or pound the desk in trying to release that anger, raising their voice, flushed skin, flexing their muscles. We've had patients who know they're about to engage with staff, start to do push-ups or jumping jacks and start to get ready.
I can remember years ago talking to my colleagues that were in geriatrics, and there was a disconnect with the topic of workplace violence because in some way they were really figuring in the lack of intent when a geriatric patient maybe lashes out at a worker as, just being part of the disease process. And if you don't name it and you don't start counting it, it's really hard to do anything about the problem. So because a cognitively impaired individual, does not intend to actually assault a caregiver who actually they could consider their loved one, that doesn't mean it's still not workplace violence, and that a worker doesn't end up being injured and perhaps, decides to leave that specialty or the profession, completely.
First, I would say workplace violence is not part of the job, and it never should be part of the job. And if you experience that, what we ask as healthcare leaders is that you report it to your appropriate leaders. Part of our issue is that it's underreported, and so therefore the underreporting leads to not leading to mitigating solutions. And so the more our staff reports, the more as healthcare leaders we are able to provide cogent solutions to mitigate these issues. And the more we're able to understand the issue.
It's not confined to urban areas where we normally associate violence. I'm hearing about these concerns in suburban and rural settings where you would never expect it. You drive up to a hospital in what looks like a bucolic environment, and then you talk to the chief of nursing and you hear stories about how nurses are physically assaulted, verbally abused, all kinds of thoroughly unexpected behaviors that really need to be stopped.
A good colleague in the Maryland Nurses Association shared with me that at one point medical errors were not talked about as they are now, and there's a just culture idea that, you know, it's okay to share when you make a mistake so we can fix it. I feel this is a very similar situation, that we need to talk about this, we need to document it, and we need to start doing something about it.